Most women do everything they're told after menopause: eat less, exercise more, take the supplements, and still end up sicker, heavier, and more exhausted than ever. Here's the brutal truth. 5 of the most common health habits after menopause aren't protecting you. They're quietly making things worse. I'm Dr. Zoe Bennett, and in my years of clinical practice, I have sat across from thousands of women who did everything right, or at least everything they were told was right, and still felt like their bodies were betraying them. Weight that wouldn't budge, sleep that never came, bones that cracked, hearts that raced, and minds that felt just a little like they were slowly going somewhere without them. These women weren't failing. The information they were given was failing them. Today, we are going to change that. I'm going to walk you through the 5 biggest health mistakes women make after menopause. Not to shame anyone, because I promise you, every single one of these mistakes is completely understandable. But to give you the truth, backed by science, that your body deserves. And I want you to stay until mistake number 5, because that is the one that even many doctors forget to bring up, and it silently affects nearly every system in your body. So let's get into it. Before we talk about what's going wrong, we need to talk about what's actually happening inside the post-menopausal body, because this is where most health advice completely misses the mark. When estrogen, progesterone, and testosterone decline at menopause, this isn't simply a reproductive shift. These hormones were doing an enormous amount of work throughout your entire body, and when they leave, everything changes. Your bones, your heart, your brain, your metabolism, your sleep architecture, all of it is affected. And here's what frustrates me most as a clinician. The advice most women receive after menopause was largely designed for either younger women or for men. It doesn't account for this new biological reality. Right now, approximately 1 billion women worldwide are post-menopausal or approaching that transition. 1 billion. And the majority of them are navigating it with outdated or incomplete information. That ends today. Because here is what I know for certain. The post-menopausal years are not a slow descent. They are a transition, and with the right knowledge, they can absolutely be among the strongest, sharpest, most vibrant years of your life. But you have to stop making these 5 mistakes first. Mistake number 1 is ignoring bone health until something breaks. This one is close to my heart because the consequences are devastating and entirely preventable. Osteoporosis is often called the silent disease, and that name is painfully accurate. It has no symptoms, no warning signs, nothing that whispers to you that your bones are thinning, weakening, hollowing out, until the day you fracture your wrist reaching for something on a shelf, or worse, you fracture a vertebra simply by sneezing. That is not an exaggeration. That is something I have seen happen. And here's the statistic that should stop you in your tracks. Women lose up to 20% of their bone density in the first 5 to 7 years after menopause. 20% in under a decade. The reason is estrogen. Most people think of estrogen as a reproductive hormone, but it is also one of the most powerful bone protective compounds in the human body. It regulates the cells responsible for building and maintaining bone. When estrogen declines, bone loss accelerates dramatically, and for most women, it does so completely silently. Now here is where the first big mistake comes in. Most women either don't think about bone health at all until they're in their 70s, or they think a daily calcium supplement is enough. I need to be direct with you. Calcium alone is not enough, and in some cases, taking high-dose calcium supplements without the right cofactors can actually increase cardiovascular risk. Calcium needs vitamin D to be absorbed. It needs vitamin K2 to be directed into your bones rather than your arteries. It needs magnesium to activate vitamin D. These nutrients work as a team, and taking one without the others is like hiring a builder with no materials and no blueprints. Beyond supplementation, the single most powerful thing you can do for your bones post-menopause is resistance training. Not walking, though walking has real benefits. But weight-bearing resistance exercise that actually puts load on the skeleton and signals your body to build and maintain bone density. The research on this is not ambiguous. It is clear and consistent. And yet, the majority of postmenopausal women are still being told that a daily walk is sufficient for bone protection. It is not. If you are postmenopausal and you have never had a DEXA scan, which is a simple, low-radiation scan that measures bone density, please ask your doctor for a referral. In the United States, the National Osteoporosis Foundation recommends all women over 65 get one routinely. But if you have risk factors, you should be asking for it much earlier. The same guidance exists through the Royal Osteoporosis Society in the UK and equivalent bodies in Canada and Australia. Do not wait for a fracture to find out your bones needed attention 10 years ago. Now, are you starting to see how much is happening beneath the surface? Because mistake number 2 is something that almost every woman I speak to is actively doing right now, and she believes it's the right thing. Mistake number 2 is eating too little, and especially not eating enough protein. I understand why this happens. Postmenopausal weight gain is real, it is frustrating, and the instinctive response is to eat less. We have been conditioned our entire lives to believe that weight management is simply a matter of calories in versus calories out. But after menopause, that equation changes in ways that make chronic undereating genuinely counterproductive and potentially dangerous. Here is what is really going on. After menopause, your body becomes significantly more likely to lose muscle mass. This is called sarcopenia, and it is one of the most underappreciated health crises in postmenopausal women. Estrogen was helping your muscles synthesize protein and maintain their mass. Without it, muscle loss accelerates. And here is the vicious cycle that this creates. Muscle is your primary metabolic organ. It is the tissue that burns the most calories at rest, that regulates blood sugar, that keeps your metabolism running efficiently. When you lose muscle, which is exactly what happens when you don't eat enough, particularly enough protein, your metabolism slows even further. You store more fat, particularly around the abdomen, and you feel more tired, which means you move less, which accelerates further muscle loss. Eating less is literally making this cycle worse. The research now strongly supports that postmenopausal women need significantly more protein than the basic recommended daily allowance suggests, somewhere between 1.2 and 1.6 grams of protein per kilogram of body weight per day. For a woman weighing around 70 kilograms, that's roughly 85 to 110 grams of protein every single day. Most women eating a calorie-restricted diet are getting half of that if they're lucky. And it's not just about quantity, it's about distribution. Spreading protein across 3 meals rather than loading it into one sitting improves how your body actually absorbs and uses it for muscle maintenance. Whether you eat animal proteins, plant-based proteins, or a combination, the goal is the same. Prioritize protein at every meal and stop treating food as the enemy. The scale is not the best measure of your health. Your muscle mass, your energy levels, your metabolic markers, those are the real indicators, and you cannot optimize any of them by chronically undereating. But here is the thing. What you eat is only half of the equation. Because mistake number 3 is about what you're doing with your body, and it involves a type of exercise that most women have been actively avoiding. Mistake number 3 is doing the wrong type of exercise. Let me be clear, movement of any kind is better than no movement. I am not here to tell you that your morning walk is worthless. It absolutely isn't. But if your primary form of exercise after menopause is steady-state cardio, long runs, cycling classes, hours on the treadmill, and you are wondering why you are exhausted, gaining weight around your middle, and not feeling any better, there is a physiological explanation. Chronic, high-volume cardio elevates cortisol, your primary stress hormone. And here is the critical problem: post-menopause. When estrogen is no longer there to counterbalance cortisol's effects, elevated cortisol directly promotes the storage of visceral fat. the dangerous deep abdominal fat that wraps around your organs and drives inflammation, insulin resistance, and cardiovascular risk. More long cardio sessions are not the answer. In fact, for many postmenopausal women, they are actively making things worse. What the evidence consistently shows is that resistance training, lifting weights, using resistance bands, body weight exercises like squats and lunges is the most powerful form of exercise for postmenopausal health. It builds and preserves muscle mass, directly countering sarcopenia. It improves insulin sensitivity by creating more glucose-hungry muscle tissue. It signals bone remodeling, reducing osteoporosis risk. It improves mood, reduces anxiety, and has been shown in multiple studies to significantly reduce depressive symptoms. And no lifting weights will not make you bulky. That is a myth that has kept women away from the weight room for decades, and it needs to end. Postmenopausal women have lower testosterone than they did in their 20s, which means building large muscle bulk is genuinely difficult. What you will build instead is a stronger, leaner, more metabolically efficient body. The minimum effective dose, based on current evidence, is 2 to 3 resistance training sessions per week. You do not need a gym. You do not need heavy equipment. You need progressive resistance, meaning you gradually challenge your muscles more over time, and consistency. If joint pain is a barrier, working with a physiotherapist before starting is an excellent investment. The goal is not to become an athlete overnight. The goal is to give your body the stimulus it needs to stay strong, functional, and healthy for the decades ahead. And speaking of something your body desperately needs that most women are not getting, let's talk about mistake number 4, which is something that gets dismissed more often than almost any other postmenopausal symptom. Mistake number 4 is accepting poor sleep as inevitable. I cannot tell you how many times I have had a patient describe waking at 3 in the morning, lying there for hours, drenched in sweat, mind racing, and then apologetically say, "But I know that's just menopause, so I don't want to waste your time with it." It breaks my heart every time, because poor sleep after menopause is not something you simply have to accept. It is a medical issue, and dismissing it as inevitable is not just unfortunate. It is genuinely risky. Poor sleep post-menopause is independently associated with increased cardiovascular disease risk, worsened insulin resistance, accelerated cognitive decline, increased rates of depression and anxiety, and weight gain. It is not a minor inconvenience. It is a foundational health problem that cascades into nearly every other system. Here is the biology. Progesterone, which declines significantly at menopause, is a natural sedative. It binds to the same receptors in the brain as calming neurotransmitters. When progesterone drops, sleep becomes lighter, more fragmented, and harder to initiate. Simultaneously, the thermoregulatory instability of menopause causes night sweats that repeatedly pull women out of the deep, restorative sleep stages they need most. The result is that postmenopausal women spend far less time in slow-wave, deep sleep, the stage where the body repairs tissue, consolidates memory, and critically clears metabolic waste from the brain through a system called the glymphatic network. Researchers now believe that disruption to this nightly brain-clearing process is one of the mechanisms linking poor sleep in midlife women to significantly elevated Alzheimer's disease risk later in life. This is not a small thing, and yet women are routinely told it's normal and sent on their way. What can you do? First, the environmental fundamentals matter more post-menopause than they ever did before. Your bedroom temperature should be cool, around 65 to 68 degrees Fahrenheit, or 18 to 20 degrees Celsius. Blackout curtains, consistent sleep and wake times, and eliminating screens an hour before bed are not optional extras. They are clinical recommendations. For supplementation, magnesium glycinate taken before bed has solid evidence for improving sleep quality and reducing nighttime awakening. Low-dose melatonin can help with sleep onset, but should not be used as a long-term solution without medical guidance. If sleep problems are severe and persistent, ask your doctor about CBTIE, cognitive behavioral therapy for insomnia. It is the most evidence-based treatment for chronic insomnia in existence. It outperforms sleeping pills in long-term outcomes, and it is not talked about nearly enough. And finally, please ask your doctor about a sleep study if you are waking frequently, snoring, or feeling unrefreshed regardless of how many hours you sleep. Sleep apnea is dramatically underdiagnosed in postmenopausal women, and it is profoundly treatable. You deserve sleep, not just more hours of it. Better, deeper, more restorative sleep. Do not accept anything less. And now, we have arrived at mistake number 5. This is the one that quietly operates in the background while everything else is happening. This is the one that most doctors don't raise in routine appointments, and it is, without exaggeration, the one with the highest stakes. Mistake number 5 is waiting for symptoms before protecting your heart and your brain. I want to say something clearly because I believe women deserve to hear it directly. Heart disease is the #1 killer of postmenopausal women. Not breast cancer, not ovarian cancer, heart disease. It kills more women than all cancers combined, and yet it remains dramatically under-recognized, underdiagnosed, and undertreated in women, partly because the symptoms women experience during a cardiac event are often different from the classic chest-clutching presentation we see in movies. Women more commonly experience fatigue, jaw pain, nausea, back pain, and shortness of breath, symptoms that are routinely attributed to stress, anxiety, or simply getting older. The consequences of this misattribution can be fatal. Here is what menopause does to cardiovascular risk. Before menopause, estrogen keeps your arteries flexible, helps manage LDL cholesterol oxidation, and has anti-inflammatory effects on the vascular system. Post-menopause, LDL cholesterol rises sharply, often within the first year. Arterial stiffness increases, blood pressure rises, and systemic inflammation increases. Within 10 years of menopause, a woman's cardiovascular risk surpasses that of a man of the same age. 10 years. That is not a distant future risk. That is a ticking biological clock that deserves attention right now. And yet, most postmenopausal women at a routine checkup receive a basic cholesterol panel and are told everything looks fine, without anyone measuring ApoB, which is a far more accurate predictor of cardiovascular risk, or lipoprotein A, a genetic risk factor for heart disease that affects approximately 1 in 5 people and is almost never tested routinely, or high-sensitivity CRP, which measures vascular inflammation, or fasting insulin, which reveals metabolic dysfunction years before it becomes type 2 diabetes. These are the tests that tell the real story, and you have every right to ask your doctor for them. And then there is the brain. Estrogen receptors exist throughout the brain, in the hippocampus, which governs memory, in the prefrontal cortex, which governs executive function and decision-making, in regions involved in mood regulation. When estrogen declines, many women experience what is colloquially called brain fog. Difficulty finding words, trouble concentrating, a sense that their thinking has become slower or less sharp. For many women, this is terrifying, and they are told it will pass. Sometimes it does, but emerging research is showing us that the postmenopausal brain is more vulnerable to neurodegenerative disease, and that the decade immediately following menopause may represent a critical window for neuroprotection. Women represent nearly 2/3 of all Alzheimer's disease cases. That disparity is not fully explained by the fact that women live longer. Hormonal biology is part of the story. What can you do? Start with food. The Mediterranean diet, rich in olive oil, fish, vegetables, legumes, nuts, and whole grains, has the strongest and most consistent evidence base for both cardiovascular and brain protection of any dietary pattern studied. The MIND diet, which builds on the Mediterranean diet with specific emphasis on brain-protective foods like leafy greens and berries, has shown meaningful reductions in cognitive decline risk. Exercise, particularly resistance training and brisk walking, improves cerebrovascular blood flow, reduces inflammation, and lowers cardiovascular disease risk. Stress management is not a luxury wellness recommendation. It is a cardiovascular intervention. Chronic stress drives cortisol, cortisol drives inflammation, inflammation drives arterial damage. Managing stress is heart medicine. And if you have been curious about menopausal hormone therapy and whether it might be right for you, I want to offer you something important. The old fears about hormone therapy largely stemmed from a misinterpretation of a study called the Women's Health Initiative. Subsequent analyses and newer research have significantly updated our understanding. For many women, particularly those who begin hormone therapy within 10 years of menopause onset, the benefits including cardiovascular protection, bone preservation, improved sleep, and possible neuroprotection significantly outweigh the risks. This is a conversation worth having with a doctor who is current on the evidence. You deserve that conversation. So let's bring this all together because I want you to leave here today with absolute clarity. The 5 biggest mistakes women make after menopause are: first, ignoring bone health until a fracture forces the conversation. Second, chronically undereating and neglecting protein, which accelerates muscle loss and metabolic decline. Third, relying on cardio while avoiding the resistance training that their body now needs most. Fourth, accepting poor sleep as an inevitable part of aging rather than a treatable medical issue. And fifth, waiting for symptoms before taking cardiovascular and brain health seriously, by which point the window for easiest intervention has already partially closed. But here is what I need you to hear above all else. Every single one of these mistakes is reversible. Every one of them has a clear, evidence-based path forward. The post-menopausal years are not a consolation prize. They are not the beginning of an inevitable decline. They are a distinct biological stage with a distinct set of needs. And when those needs are met with the right knowledge and the right support, women in this stage of life can be stronger, sharper, more energetic, and more in control of their health than they have been in decades. The research supports this. I see it in my clinic, and I believe it for you. Here is my practical ask. Go and get a baseline health panel. Request a DEXA scan. Ask for an expanded cardiovascular panel including ApoB and LP. Check your fasting insulin and have your vitamin D levels tested. Build what I call your post-menopause health team, a primary care physician or GP who takes this stage of life seriously, ideally a gynecologist with specific menopause training, and if you can access them, a registered dietitian and a physiotherapist. Adopt the 3 non-negotiables starting this week. Prioritize protein at every meal, begin or intensify resistance training, and treat your sleep as the clinical priority it is. And please, do not accept dismissal. Do not let any healthcare provider tell you that what you are experiencing is simply aging and there is nothing to be done. There is always something to be done. You deserve a doctor who knows that. And you deserve the information to walk into every appointment prepared, informed, and advocating powerfully for yourself. Because that is exactly what you are doing right now.